What is the best treatment for acne scars?
Acne scar management requires proper evaluation and clear communication about expected outcomes and long-term strategy. It's very important to understand that one strategy for acne scars doesn't apply to everybody, and it's not usually a single one-off process where we do one thing and then you're done. When you seek opinions from doctors regarding acne scar treatment, keep in mind that you will get different opinions because there is more than one way to approach these issues. Practitioners make recommendations based on a perspective of experience and often whatever is the latest branded device they're currently leasing. I'll discuss the steps I take in evaluating a patient with acne scars and how I make my recommendations and set expectations. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform a wide range of procedures for patients with acne scars, including lasers, use of radiofrequency technology, skin boosting, regenerative medicine technology such as PRP or platelet-rich plasma and acellular matrix, as well as acne surgery such as subcision, scar removal, and skin grafting. When I look at a patient with acne scarring, I take high-resolution digital photos, and I also take photos with a method called backlighting to look at the shadows, which provide me with information about the depth and extent of the scars. Acne scars are typically classified as rolling scars, boxcar scars, and ice pick scars. There are different levels of all these scarring, and a strategy is developed based on these specific classifications. When you're dealing with acne scars, you are dealing with one common issue: tissue loss. The underlying strategy is to maximize the volume where tissue is deficient and to blend the interface between the normal skin and the adjacent area of tissue loss. Unfortunately, many people with acne scars literally jump from one laser to another based on aggressive marketing, resulting in frustration and disappointment. A very important limitation is the generally accepted standard amongst ethical professionals as to the maximum level of change that can occur with acne scars. Generally speaking, improvement of about 20% followed by maintenance procedures is a realistic expectation. Of course, the term 20% can be up for subjective interpretation. For my patients, I find that defining success as an improvement avoids unrealistic expectations. My approach to acne scars is comparable to my approach with facial aging. I create a customized strategy to work from the inside outward. For example, if the cheek volume can be enhanced, I will place a long-lasting filler such as Juvederm Ultra Plus or Juvederm Voluma at the bone level. The improvement in projection can have a significant effect on softening the appearance of acne scars. This becomes particularly relevant with the natural progression of facial aging. I also see how improvement in volume and facial balance can shift focus away from the acne scars. At the skin level, although it is commonly accepted that various lasers can help depress scars by controlled injury, which then stimulates a healing response by cells in the skin called fibroblasts to produce collagen. The question is, how much of a difference can be achieved when the tissue is scarred? In addition, how much collagen generation can occur when the patient has had one or more previous laser, radiofrequency, or microneedling procedures? I find myself consistently integrating the use of PRP or platelet-rich plasma to induce collagen production without causing any significant injury as a first line before or in conjunction with non-ablative laser treatment. PRP, or platelet-rich plasma, not only stimulates collagen production, but also improves blood supply and softens the scar tissue. In particular, for patients with boxcar scars, I find this strategy useful. I routinely combine PRP with hyaluronic acid filler, which is delivered to the dermis using a procedure called skin boosting. Rolling scars and scars associated with a lack of underlying fat are often managed through a combination approach. Procedures such as subcision, injectable fillers are placed on the bone level, below the skin, and in the dermis. That combination can be very effective. There is also a type of ablative laser technology often beneficial, particularly for boxcar scars. These are scars with very sharp, defined edges. Generally, when using a laser, we try to soften the edges of these scars and then blend the skin so that the skin heals smoothly for improvement. Another approach, which is more convenient and beneficial, particularly for shallow scars, is water-based microdermabrasion, or a procedure that is called HydraFacial. There is no downtime, and the improvement in the skin can be appreciated immediately afterwards. I recommend that any therapeutic strategy for acne scar involve regular follow-up examinations and some maintenance procedures which are customized to the individual. In a time where devices get aggressively marketed and unrealistic expectations are promoted, it's more important than ever for you to find a physician who you trust to have your best interest at heart. All too often, new devices come on the scene and many doctors buy or lease these devices and then think only about the profit from the transaction and have no interest in a long-term management plan. I recommend you meet with experienced doctors and make sure you feel that you're being well informed and you have confidence in the doctor's treatment plan for you and what the short-term and long-term outlook will be. I hope you found this information helpful. Thank you for your question.